In other news, Eastern Cape Premier Oscar Mabuyane is set to officially open the expanded Edge Day Hospital in Gqeberha, a development expected to boost healthcare capacity in the province. The facility forms part of a public-private partnership aimed at easing pressure on overcrowded health institutions, while also contributing to local economic growth through job creation. For the very latest on this expansion and its impact, let's bring in SABC News reporter Sisipho Ngcumbe live to us now from Gqeberha in the Eastern Cape. And Sisipho, help us, I suppose, get a sense of how far this expansion is likely to go in easing pressure on other institutions.
Well, a very good morning to you, Ayanda, and a good morning to the viewers at home as well. We're out in Gqeberha this morning in the Eastern Cape, where the provincial government is set to officiate the expansion of private hospital, Edge Day Hospital, here in Nelson Mandela Bay. Now, you'll understand, Ayanda, that over the past couple of years, over the past couple of months, the Eastern Cape Public Health Department has faced a number of issues, ranging from an issue in capacity to some issues in insecurity at hospitals such as Livingston and Dora in the township of Gqeberha. Now, the province is positioning this expansion as an increase in investment, and particularly in investment through the collaboration that will be formed between this hospital and hospitals such as Livingston going into the future. I'm joined now by the acting HOD for health in the province, that would be Dr. Gqeberha. Dr. Gqeberha, thank you so much for your time. Let's begin, Doctor, with just explaining this expansion. First of all, how does it look? Phase 2, I believe, now that we're in. So how does it look? And then also, how does this directly increase the capacity of the public health department?
Yeah, thank you for having me. And we're here as a health sector, but as part of a wider government delegation to celebrate this special moment. As you have indicated, it's additional capacity to the Eastern Cape healthcare platform. So as you understand that we are a sector that has got public and private, and any additional capacity here brings definitely better improvement to access to care for our patients. And it also brings us closer to our reality of national health insurance or universal health coverage. So that is exactly why we are here. As you have indicated earlier on, the future is collaboration, between a public sector and private sector, as we all together are fulfilling a joint constitutional mandate, that is provision of basic health services to all citizens of the country. So we're here not as visitors, as guests, but as partners to this development. Edge Hospital is also a new format of the platform. It's a day hospital, and this is the direction in which all of us should be going, as it actually produces beds that are much cheaper to use, and they're more effective. So patients come here for intervention and go back home for recovery. That reduces the costs, and reduces inconvenience to patients. And also your medical aids will go a lot longer. The public sector, remember, is also exposed to high cost of care. So this is the format that we're doing. Although we have these in our facilities, but they're integrated within a bigger platform. But this is the future for the healthcare system.
Dr. Gqeberha, talk to us about the specifics of the collaboration between Edge and hospitals such as Livingston, the increase in investment, and how will the public, maybe someone who doesn't have medical aid, is there going to be a benefit to the public as well as to those who are privately funded?
Yes, what's unique about day hospitals is they're generally affordable, to some people, especially what we always call the missing middle. People who cannot afford an expensive medical aid and would also love to get an alternative platform for care that's not necessarily public. So day hospitals are generally affordable. So someone who's paying cash can actually come here, have a procedure done, and it really won't break their bank balance. It won't damage their financial standing. So in that regard, it is a good addition to what we're already offering in the platform. And the second part is of collaboration is that we're working very closely, especially here in Eastern Cape, with private sector. Just recently, we were celebrating the Nelson Mandela Month, and we did 300 tonsillectomies with ENT specialists led by Professor Miyataza. So Dr. McIntosh actually was part of the team that offered those free services for a month to do those tonsillectomies on the young ones. So the collaboration is already in action in Eastern Cape. So we're working together to reduce the backlogs, especially surgical backlogs. We're looking forward to improved forms of collaborations where we may even have access to these facilities and those of other, like South African Military Health Services, in order to reduce the backlogs and the waiting times, in Eastern Cape.
And Doc, just finally, this, I imagine, would also have an impact on alleviating challenges such as unemployment, understanding that there are doctors who occasionally will protest that they're unemployed here in the province. Many young people with skills taking them from the Eastern Cape and running to other provinces. So how does this assist in alleviating unemployment in the medical sector, in other sectors as well that may benefit from a project such as this?
Definitely, every extra bed and every extra facility that is opened does have an impact. Doctors have an opportunity to come here, even the junior doctors, while the public sector is generally producing them, but we're not in a position to absorb all of them. So private sector growth is a great opportunity for the doctors to find employment and even profitable activity outside of public health sector. For a very long time, public sector has solely been the sole employer for these young doctors, but now facilities like these where doctors can either do locums or even do some private work, after hours, it's always welcome that it's done. But moreover, this facility in particular is also accessible to international clients. I'm getting closer to job creation. So it has a bigger economic impact in this region. Whether it's your hotel services, there are clients who come from other parts of the world just for a certain special procedures. Yeah, there's something they're doing very well in this place, which I think we'll get to know when you interview the owners and the practitioners inside there. But it's a wider economic impact in the region beyond just the treatment of patients.
Dr. Kamlashe, thank you so much for your time.
Thank you very much. Thank you.
That was the acting HOD for public health here in the Eastern Cape, Dr. Kamlashe, who was just letting us in on how exactly or how widespread the chain will be when it comes to benefiting the economy of the Eastern Cape, and in particular Nelson Mandela Bay, where we've seen many woes in the public health department, but now we see that investments such as this are coming to collaborate, work hand in hand with the public health department. We will, of course, be talking to some of the organizers, some of the managers of the hospital as the day goes on, and hoping to hear a little bit more on the specifics, maybe how many beds, how many people will be, helped. I also spoke to one of the media people here earlier on, and she mentioned that the collaboration also goes far beyond what we have already mentioned here, but the collaboration will also reach to a point where when a client or a patient comes here and they need assistance here at the Edge Day Hospital, and perhaps they need specialized assistance, that client who is on private medical aid will then be sent to Livingston Hospital, where the medical aid will then cover their expenses there, thereby increasing the investment back into the public health system. But as I said, Ayanda, we'll be talking to more stakeholders here today and hoping to get more of a feel of exactly what this means in the province of the Eastern Cape and specifically in the Nelson Mandela Bay Municipality Metro.
And we certainly look forward to that reporting. For now, Sisipho Ngcumbe live to us from Gqeberha, more specifically outside the Edge Day Hospital. Thanks very much indeed.